Hi, and welcome again to Explore Owens. My name is Maddie Harris, part of our admissions team here at Owens Community College. Thanks for connecting with us today. We are sitting down, more so standing, 6 feet apart with Lori Maynard. She's our chair of surgical technologies and sterile processing. Thank you for taking time out of the first week of classes to chat with us. Lori, how are you doing?
I'm doing great. Thank you for having me.
Yeah.
I am the chair of surgical technology and sterile processing. I have one class a year, one admission a year. The surgical technologist helps the surgeon in the surgery during the operation by passing the instruments to them correctly, anticipating what they're going to need for the case, keeping and maintaining a sterile field so that the patient doesn't get an infection. All these things are part of what a surgical technologist does. Communication is very important, anticipating, and sterile technique.
So with the surgical technology program, what can students expect as far as a career path after graduation? I know you mentioned a few before we got started today, and I blew my mind just the different paths that our students could take.
Yes, a surgical technologist can work in the hospital. The majority of surgical technologists work in a hospital. They can also work in an outpatient surgery center. We have surgical technologists who are employed in labor and delivery. Another direction that surgical tech could go is in surgical sales. So if the company makes something like this, which is a clip applier for a vascular bleed or something, then it has to be demonstrated and shown how it works. So you could go into surgical sales. Another direction would be a traveling technologist, where you would accept an appointment or a contract for a certain amount of time, go to wherever in Georgia, work at their hospital for 13 weeks, complete your contract, and then come back home and take another assignment. I think that. You could become an educator for other surgical technologists.
Like yourself.
Yeah.
You currently work in the field?
I do. I work per diem, so I just work when they need me, and when I have a day off from here, or I take a vacation day from here.
Awesome. That is the case with a lot of our staff and faculty here at Owens, and you are an excellent example of our faculty and staff who work currently in their field. Lastly, Lori, what time frame to finish the program, the Surgical Technologies program, can students expect? How long can they expect to be in school? Is there additional testing afterwards? What does that look like?
Okay, the surgical program at Owens is 22 months. It takes 2 years. First, you start with the sterile processing portion of the program. All students have to take that, all surgical students, where you learn the instruments, what their name is, and how to inspect them, just to make sure that they're safe to be used during the surgery. Then after that, we start with the setup and how to scrub, gown, and glove, passing the instruments, anticipating the next move, the steps of the surgery, a lot of anatomy and physiology, a lot of pharmacology.
I can imagine.
All of those things are very important to surgical technologists.
Awesome. Thank you, Lori, for taking time out of your day to be with us and share that wonderful knowledge. Join us again next week for more Explore Owens here at Owens Community College. Again, Maddie Harris with our admissions team. I wish you well on your journey, and remember that your success can start right here at Owens.